everybody. My name is Jessica, also known as Procrastination MD on Instagram, and I am here for a special YouTube video with Master Resident, here to talk to you about the differences between preliminary years, transitional years, and why you might choose one over the other for your residency applications. So real quick, the programs that you have available to you tend to be like categorical or advanced. And the only reason that you would need to apply to a prelim or transitional year is because you would be also applying to an advanced residency program. So what is an advanced residency program? An advanced residency program means that it starts your training at your PGY1 year. So your intern year is not like included in that program. So when you apply, you need to apply to your advanced program as well as your intern year program, either in the form of a preliminary year or a transitional year. So the types of programs that are advanced would be urology, ophthalmology, dermatology, diagnostic radiology, PM&R, neurology, which is what I applied to and matched into, psychology, and like anesthesiology. So if you're not applying to an advanced program, you probably are applying to a categorical program. Categorical program means that your PGY1 intern year is included in your entire training. I was accepted into a categorical neurology program, which means that currently I am doing my intern year at the institution that I will also complete my advanced neurology training in. So when it comes to advanced years, here's a couple things you'll have to take into consideration. You need to apply, yes, to a prelim or a transitional year, and that means that you could complete your training in another state and then have to move and then go to finish your advanced training in a different state in a different facility. Some advanced programs do include their preliminary year. Not all of them, but some do. The one program that I applied to that was advanced did include their preliminary year. So let's get into preliminary years and transitional years, and again, why you might want to choose one over the other. So real quick, you have two types of prelim years. You have your internal medicine prelim year, and then you also have a surgical prelim year. So the curriculum for both of those tends to be different. Obviously, if you're going into a preliminary surgical year, then that means that your training is going to be primarily surgical. This could be a good option for you if maybe you didn't match into a surgical program that you wanted right away, or like say you didn't match into that program and like you still want to continue and do your intern year in surgery, and then you might reapply to a program next year for the completion of that surgical training. The things that you would do in a surgical preliminary year, the type of curriculum. So I got this from Mayo Clinic's website, so this is just an example. You would do something along the lines of this. You'd have training in colorectal surgery, you'd have like elective months of surgery, you do gen surge, vascular surgery, plastics, pediatrics, trauma, and critical care. So your preliminary surgical year is surgery, right? If you are applying to a gen surge program, like a categorical, that means that this will be included in your first year training. Again, this could be a good option for people who maybe didn't match into the gen surge program that they wanted initially, and so they want to cover their intern year and apply to a prelim surgical year. I think where it gets a little more confusing is in the programs that aren't necessarily surgical, and so you have the option between a prelim internal year and a transitional year. So what's the difference between the transitional years and the preliminary years? Internal medicine. The biggest difference is that transitional years kind of is like a repeat of your core clinical rotation. So you're doing internal medicine as well as like surgery. So you're doing everything. Whereas preliminary internal medicine is strictly like internal medicine. You're not doing any surgical procedures, or like you really shouldn't be. And so when would you choose one over the other? I have a friend who matched into an advanced radiology program, and when I was talking to him, I asked him why he chose transitional year over preliminary year, and the reason he chose the transitional year was because the curriculum is such that you see all specialties, so you will see a lot of diagnostic imaging, and he felt that that was the better choice for him. Transitional years also kind of tend to be a little more chill. with respect to the workload. So an example of a transitional year curriculum, again, this is from, where did I get this? From Mayo Clinic, sorry. So transitional year at Mayo Clinic looks like this. You have a rotation on acute illness care, you have anesthesiology, cardiology, you have some electives, you do emergency medicine, gen peds, intensive care unit, and critical care. You do internal medicine, inpatient, nephrology, and pulmonary medicine. My friend who's doing his training, his kind of looks like 3 months of medicine, 2 months of emergency medicine, 2 months surgery, 1 month OBGYN, 3 months elective. And honestly, that'd be a great year for you, especially if you're studying for step 3, because that kind of covers all the step 3 topics. So that's also another thing that you could take a look into or like take into consideration when you're applying to these programs. Preliminary medicine, however, is something like this. You would do, internal medicine care, you'd be on the medicine floors, and you'd be doing gen med. Again, this is from Mayo Clinic, just as an example. Gen med, cardio, medical ICU, ambulatory medicine, emergency medicine, hematology, GI, neurology, and then an elective or float. So it kind of depends on again, the program that you're going to be going into. My friend who's doing radiology, the reason again why he chose transitional year over preliminary medicine year is because you are seeing all of the specialties, surgery, OB, everything. Whereas preliminary medicine, for instance, technically my year, I'm in a neurology program, so I'm doing strictly internal medicine. I don't think it would make necessarily a whole lot of sense for you to do a transitional year for a specialty that is kind of more medicine based, not necessarily like procedure based, I guess, or like surgically based. And again, it wouldn't make sense for you to apply to a prelim surgical year if you're doing something like, I don't know, neurology or psychology or something like that. So that's the biggest difference between them. It tends to be confusing, and I think also where it gets kind of confusing is when you wind up ranking your programs. So again, when you apply to an advanced program, you need to also apply to a preliminary year, so you need to cover your intern year. When you do this on your rank list, you have your main list, right? And then you have supplemental lists. So your supplemental list is like your transitional and prelim years, and you kind of like match them. So like you can have, I think, 3 supplemental lists, like A, B, and C. And pretty much like when you rank an advanced program, it's gonna be like, okay, well, you have to have a supplemental list, and you'll put your transitional and preliminary years in your supplemental list. When you match, like say you match into your advanced program, then you'd also like match hopefully into your preliminary or transitional year. It is possible for you to match into your advanced program and not match into your preliminary intern year program. You do have the opportunity to soap into a preliminary year program or your intern year program. They don't always go like 100% filled, so don't sweat it if you do only match into your advanced program. But again, just take into consideration like how you kind of want to be spending those years and how far you're going to want to move, because you're really not going to have a whole lot of time to move in between your intern year and your PGY2 year. So that's that. I hope it was helpful. I hope it clarified a bunch of things. I know I was really confused when I applied last year. I applied to a bunch of prelim programs. I applied to advanced programs, but like I only got an interview with like one advanced program. Most of my other programs that I interviewed with were categorical because I didn't want to have to find a prelim year. So that's up to you, whatever you feel, is going to be the best fit for you. And also, I mean, if you think that you wanting to just apply primarily to advanced programs, then make sure you know what you want for your prelim and your transitional years. On Match Your Residence website, they do have the option for transitional years, so don't sweat it. If you're not sure where to apply for a transitional year, get a membership to their website, and they also have transitional years, so where you can see where your statistics line you up for the best opportunity for interview. Again, I hope this was helpful. If you want, you can follow me on my Instagram, ProcrastinationMD, where I do a lot of videos like this, just giving advice on residency applications, things that I wish I knew, things that I was confused about, whatever. I hope this was helpful, and yeah, so go ahead, give me a follow at Procrastination MD, and continue watching the stuff here on Match Your Resident, because they have a lot of great information, and I personally use them during my residency application cycle, and I love them. I can't say enough things about them. I mean, I did do the work, but I give them a lot of the credit for doing the groundwork for me, for finding the programs. So again, I hope this is helpful, and yeah, good luck in your applications. I'm sure you guys will all do great.